placement certification we have performed. And thank you. So, so I think this is the first transformation which happened for this year. So this when everywhere they were doing total knee replacements and in and out. So I always felt that total knee replacement is no doubt it's definitely a very good procedure, but when it's done for a very badly damaged joint, when patient just has pain and still they otherwise it's a normally functioning knee joint, so the patient doesn't get good satisfaction out of total knee replacement. So always, it's the worldwide statistics that total knee replacements gives around 85 to 88% satisfaction. So when I felt that there is much more scope where you can give more. Excuse me. It's going on. So the patients are still need some better quality care in regards to surgical treatment. So then we came up with partial knee replacement surgeries. So here it's definitely a less small minimal invasive procedure, lesser bone loss, less blood loss. Since the injury is far less, and we just resurface the procedure. It's more of resurfacing procedure. We just address the issue. So more 80% of the natural knee joint is retained, so the patient can feel the natural knee joint again. So all the ligaments, everything is still preserved. It's more joint preserving surgery. So the feel of the knee joint is still intact. So patient satisfaction rate keeps increasing because of that. And it doesn't stop there. So the next transformation, the second transformation, and this is the gateway for that. So this partial knee replacement helped us to open up this outpatient or daycare joint replacement surgeries. So what I truly mean by outpatient joint replacement surgery is the patient walks in by the morning and gets their procedure done, and she walks back to her home the same day, evening, without any IV lines, no catheters, no urinary catheters. She walks back just like that with the walker support, and the recovery and rehab, everything happens at home. So isn't it something amazing? So total knee replacement, previously how it used to happen, just imagine a situation, patient undergoing an orthopedic procedure, them being in the ward, they will have so much of pain, and just when they try to catch up a sleep, the staff nurse will come inside, knocking the doors, taking the vitals, disturbing their sleep, giving them medicines, and then next day morning they'll walk with urinary catheters, with so many drains and with so many attachments and connection with them. So, but just imagine a situation where in the morning you have a surgery, the next day you're walking without anything at the comfort of your home, looking at the face of your family members, being in the couch and sipping a coffee inside the home, and you walk alone without anyone's support, going to the restroom without any catheter. So that's exactly what she was experiencing on the day one of her procedure. So how we achieve this is definitely a big game changer. It's just not about how we did the procedure. This is a team approach. It's not just about the surgeon. So it's a team approach. The entire team, right from the top surgeon to the caregivers, to the physiotherapist and staff nurses, everyone should be on the same page. So this starts right from the patient selection. So that itself is a very critical thing. So how to do this in a very safe way? So me and my anesthetist, and we had some references from the US as well. So we came up with a tool of how to analyze the risk and do it in a much safer way. So patient selection plays a very important role. And as I previously told, pre-op education and training, most of the work happens pre-operatively rather than happening in the post-operatively. No surprises after the procedure. So in fact, our therapists, they go to the patient's house pre-operatively itself, see if there are any barriers inside the house, and also train them with the walker. So patient doesn't suddenly come up with seeing a walker after the surgery, doesn't know how to walk. So they will be trained before the procedure itself how to walk. So it goes inside her memory, and right after the procedure, everything is all familiar to her. So all these things makes a big difference, and we spend one whole day educating the patient as well as the caregiver on how to do, how will be the procedure day, what exactly happens inside the procedure and everything. So everything is well discussed, and the patient and the entire surgical team are in one single page. And of course, for this, it's just not about the verbal communication. Okay, anesthetist will give the anesthesia this time. It doesn't happen like that. So we have very strict standard protocols. We charted out each and every detail to the minuscule. We have charted out, and we work accordingly. So only then we can achieve. Here, it's all about precision and timing. So every single minute matters a lot. For example, when the patient comes in the morning by 5:30, the procedure will start exactly by 6:30, and then by 1 p.m. she'll be having her lunch, and by 2 o'clock the therapist will come and like make her walk with some few baby steps, and then by 4 to 6 p.m. She will be walking around the ward, train her for the toilets, and then by 6:30 she will be planning for discharge. So everything for all this to happen, everything goes by exact timing. Every medicines were given by the staff nurse. We act very proactively. We don't ask for the patient, okay, do you have pain, and like that. So even before anything comes, we act. So pain is well taken care even before they complain of that. So, and this definitely cannot happen just overnight. Overnight, we cannot come up with a daycare procedure. So our previous clinical results have constantly proved that. So when we started initially, it was all 3 days. After we send the patient home, 3 days, 5 days. Now we have gradually reduced it to 1 day, and then we can achieve this daycare procedure. And we learn a lot from our own patients. Our patients are the biggest resources. So we try to learn so much from the patients and get every information from them and how to make it more simpler. The procedure making it more simpler, so that's how we learn. So here is a graph which you can see, from 1987 to 97. Those days, single size replacement surgery would almost take a patient to stay in the hospital for almost 7 days. Then gradually by 97 and 2000s, it was reduced to 5 days. And then after that, around 4 days and 3 days and 2 days. And like 2017 onwards, it became around like 1.5 days to 2 days. And right now, 2018, it's 14 hours. So this year, we've started it, it's gone to 14 hours. And this is how I look at the future of the length of stay. For example, a unicondylar knee surgery, that's partial knee replacement, will take around 2.2, and total knee replacement takes around 3.3, and total shoulder replacement will take around 4.4 hours, and hip around 4.6. So previously we used to discuss about all these 3.1, 2.1, 4.4, everything was in days, but now it's going to change to hours. All right, so this is our satisfaction. Once the length of stay, the patient satisfaction is anxiousness towards and the fear of surgery and anxiousness towards admission. So 2015, when our length of stay was pretty high, so 2000 it was around 87% where patients said it was great to undergo a total knee replacement surgery. Whereas when it comes to 2008, as our length of stay goes down, so it starts to increases around 90% and 91.8%. So around 98% of the patients feel that the surgery is around great to good. So probably we are achieving more, we'll keep achieving more as the length of stay goes down. So more great results is what we are expecting. So me and my anesthetist, we were having a chat, we had a discussion, and we were looking at our data previously about the patients, how many patients would have got benefited out of the same daycare procedure. And to our surprise, it was 54% of the patients who could have been done for a daycare procedure, and they could have benefited out of a daycare procedure. And it's just not about patients benefit about the comfort and lesser infection rate and all that. It also influences on the cost as well. So the cost goes down by previous step. Yeah, the cost goes down by 30%. So that's something which is beneficial less for the insurance companies as well. The cost goes down directly as the hospital stays. There is no hospital stay, there is no and all. Patient comes and walks back, it goes down, and lesser infection and lesser complications. So definitely the cost goes down because of the treating the complications and treating investigations. All those costs definitely goes down. So this is not something very new or happening new in the world. We are not trying to experiment anything. So there is enough studies which have already come up. So US are the pioneers of this. They have come up with so many studies. They keep coming up plenty of studies. Around last 2 year study which shows around 1,230 joint replacements are done, and there are like plenty of studies which keeps saying that it's a safe, very safe procedure and done very effectively. So around 2050, we expect around 1.4 million to 4 million outpatient joint replacement surgeries in US. So here I've pulled up a data from the United States.